I've been performing bone surgeries for over 30 years now. In the early years, I mainly focused on facial contouring procedures like cheekbones, jaw angle, and chin surgeries. But for the past decade or so, my work has centered more on facelift surgeries. Interestingly, despite the different techniques, the ultimate goal is always the same: to create a beautiful, youthful facial line. One of the most important features I focus on is the anterior cheekbone, or what we refer to as the anterior cheek projection. If you look at classic beauties like Audrey Hepburn or Elizabeth Taylor, you'll notice how their anterior cheekbones slightly project when they smile, giving their faces a soft three-dimensional charm. In Korea, actress Kim Won-hee also has beautifully developed cheekbones, and her smile looks so natural and elegant. On the other hand, someone like Anne Hathaway has relatively flat cheekbones. Her facial features are large and attractive, of course, but with a bit more anterior cheek volume, her face could appear even more dimensional. The key difference is that Westerners typically have more defined bone structures, so prominent cheekbones can enhance their beauty. But for East Asians, who generally have smaller facial features, overly wide cheekbones can actually take away from the aesthetics. That's why I don't just reduce or shave down the cheekbones. I focus more on what to preserve and what to refine. Traditionally, cheekbone reduction involved cutting the bone and pushing it inward before fixation. But in many cases today, especially during facelift procedures, I prefer a more delicate approach. If the bone is exposed, I carefully trim only the necessary areas. Think of it like treating a cavity. You don't remove the whole tooth, just what's necessary. Similarly, I preserve the anterior cheekbone and subtly refine the 45-degree outer cheek, the infraorbital area, or the lower cheekbone. This results in a more natural and harmonious facial contour. Bone surgery often leads to skin sagging, so facelift procedures should be combined when needed. I remember a case around 2006. A patient who had undergone full facial contouring later required a facelift due to significant skin laxity. Because I've long combined bone surgery with facelifts, I always approach each case with a comprehensive perspective, considering both the bone structure and soft tissue dynamics. That, I believe, is the key to achieving a truly beautiful, natural-looking face that ages gracefully.